So good morning everyone. So I'm Dr. S. Niranjani from Shri Sathya College of Nursing, Shri Balaji Vidyapith, M2B University. So today we are going to see a topic from the subject Community Health Nursing. So before entering into the topic, I just wanted to give you all a small introduction about my topic. So what is community health nursing? Community health nursing is nothing but preventive and social medicine. So the subject itself is focuses more on the preventive aspects. So prevention, what is prevention? Prevention, we all think it is just preventing a disease occurrence, preventing us from any sort of disease occurrence. It is not so. So prevention can be done in any stage or any levels of healthcare. So that's what we are going to see today. So this is levels of prevention. Today we are going to see about levels of prevention. So just one small introduction about this. The concept of levels of prevention is a fundamental principle in public health and epidemiology. It focuses on preventing disease occurrence, detecting it early, and reducing its impact on individual and communities. Prevention operates at different stages of disease development, from promoting health and preventing risk factors to providing treatment and rehabilitation. This is what I told you. So prevention is not only about preventing a disease occurrence. It can be in any stages of disease development, that is from preventing the risk factor to providing treatment or even rehabilitation. So actually we have four levels of prevention, the four main levels of prevention, each aiming to interrupt the disease process at specific point. Understanding these levels helps the health professionals plan effective strategies for maintaining and improving community health. Why we have to know about these levels of prevention? Because few will come to us before the disease occurrence, and few will come after the disease occurrence, and few will come with the amputated leg. So our care and prevention should be different in all these levels. So that's why we should have the knowledge about the different levels of prevention. So next, I already told you we have actually four levels of prevention, that is primordial prevention, primary prevention, secondary prevention, and tertiary prevention. So this actually before no, we had only these three levels: primary, secondary, and tertiary. This primordial prevention is a new concept which is emerging now. So we'll see one by one in detail. Primordial prevention. It refers to the prevention of occurrence or development of the risk factors in countries or population groups in which they have never appeared before. So primordial prevention efforts are intended for discouraging children from adopting hazardous lifestyles. The main intervention in primordial prevention is through individual and mass education. So what this primordial prevention means, we are preventing the risk factors of few diseases. Okay, what may be the risk factor? So now everywhere you go and see so much many adults and many younger adults, older adults, and old ages, they have one or the other non-communicable diseases like diabetes, hypertension. So what is the root cause for all these NCDs? The root cause is poor lifestyle. Your poor lifestyle includes uh, dietary pattern, poor dietary habits, poor physical exercise or activities, and poor sleep, poor rest, and availability of more junk foods. So these are the poor lifestyles. So when the child is being practiced with this poor lifestyle, when they grow to adult or old age group, they develop all the non-communicable diseases like diabetic, cancer, hypertension, and what so. So they develop all this. So what we have to do is we have to make the children to adopt the healthier lifestyles. So how can we make them to adopt this better lifestyle is only by individual and mass education. When we go for the community visit or when we are organizing some mass health education program, we can have this type of topics, and we can educate the children about the good habits, good lifestyles, so that they can bring a very big change in future. So that is primordial prevention. So primordial prevention is nothing but we are controlling the We are controlling the risk factors itself from the occurrence. We are not letting the risk factor itself to grow. Okay, so that is primordial prevention. So next we'll see about the primary prevention. So primary prevention goal relies upon holistic approach that signifies intervention in the pre-pathogenesis phase. In primary prevention, necessary preventive measures are taken prior to the onset of the disease, which removes the likelihood of the disease occurrence. So, this is what this is like prevention is better than cure. Okay, so we are trying to prevent the disease, particular disease, before it is going to occur. Okay, how can we prevent? Like vaccines, giving vaccines for them. So by giving some communicable disease, if you take communicable disease, how can we prevent us from the communicable diseases? By giving particular vaccines, we can prevent us from acquiring the disease. So that is one of the primary prevention. It promotes individual's attitude towards life and health and necessary steps he takes for himself, his family and community. So here, no, not only vaccines, like if at all we can take the COVID-19 scenario also. So what we have done during COVID-19, we have isolated we have isolated if anybody is with the COVID-19, they are diagnosed with the COVID-19, what we have done? We have done the quarantine. And if somebody, we have to go and meet them, what we have done? We have weared masks, all personal protective PPDs we have used, and we go and meet the patients, or we avoided going to the public places, crowded places. So these are all one of the primary prevention, that is preventing us from getting exposed to that environment from the disease. Okay, that is primary prevention. So primary prevention interventions, how can we do this? Primary prevention is by health promotion and specific protection. So health promotion, the same here also, is considered to be a behavioral social science that comes from the biological, environmental, psychological, physical, medical sciences to promote health and prevent disease, disability and premature death through educational, voluntary behavioral change activities. How can we do health promotional activities? Only by, we can achieve this by health education. Okay, behavioral change can be done only by giving them proper education and awareness about the topic. Most of the diseases are occurring just because of the lack of knowledge and awareness. So for example, we can take HPV, cancer. Okay, we know HPV vaccines are available. So if you take the vaccine, you can prevent the cancer cervix, you can prevent. Okay, so the education, many of them, they doesn't know about the disease. So few don't know that maintaining the poor environmental hygiene, like stagnation of water, may lead to dengue fever or malaria. So whenever we go to the community, we have to educate them and create awareness to empty all the water in the road, or in the household barrels and all. We should cover them and keep. So this type of awareness we have to give them. Okay, so that is health promotional activities. And next is this health promotional approaches can be done by health education, as I told you, environmental modification, that is also we have discussed, nutritional interventions, and lifestyle and behavioral changes. First we'll see about the health education. So health education, what is health education? Health education is defined as the consciously constructed opportunities for learning involving some form of communication designed to improve health literacy, including improving knowledge and developing life skills which are conducive to individual and community health. So this is health education. This is nothing but, I have explained already. This is just designated to improve health literacy and improve the knowledge and life skills of the individual and the community. Environmental modification. This is a mutual relationship substitutes between the human health and the environment that is known from many evidences. Environmental modification are thought to be important addition to health promotion. So poorly ventilated fireplaces, stoves, water quality, food resources, and food quality contribute to the ill health. So Environmental Protection Agency reports on relationship between long-term use of the pesticides and birth defects, nerve damage, and other long-term developmental problems in children. So environment, uh, always know, we have to be in harmony with the human being, should be in harmony with the environment. Any changes in the environment will obviously affect the human beings also. So environment is a place where we live, where we work. So that environment should be kept clean, that environment should be polluted, pollution free. So the chemicals which you use, that should not affect us, affect the human beings. So many things are there in the environment to be modified for our better health. So that can be educated to them. We can educate them how the water quality can be improvised, how we can prevent us from mosquitoes, that is we can prevent from water stagnation in and around houses. Okay, so drainage systems, we can have proper drainage systems. So these environmental modifications if we do, that will obviously affect, give effect in the positive health. Okay, so that is environmental modification. Next is nutritional modifications. Nutrition, obviously whatever you eat for yourself is what you build for yourself. Malnutrition impairs the growth and development and causes death of many million children. In general, healthy nutrition contributes to the physiological, mental, and social well-being of the individuals. Nutritional interventions are designed to promote health and reduce the risk of diseases. Adequately nourished people enjoy optimal growth, health, and well-being. India has launched many nutritional programs sponsored by the central and state governments in order to promote the health of the children, antenatal, postnatal women, as well as the old age people. So nutrition modifications, how this can be achieved. So everybody, they don't know what is iron rich food. Many people, they were not aware about what are all iron rich foods, what are all calcium rich foods, and what are all foods can be taken in old age, what can be given to the children. Many people, they are not aware about all the nutritional things. So being a community illness, we have to go there whenever we go for the community home visit. We have to give them education about the nutrition based on their age. Adolescent girls, they should be given health education about the iron rich diet. Children should be, we should give them about a protein rich diet. And old ages, if they are diabetes or hypertension, according to them we have to give the dietary advices. When the nutrition modification is done, or they follow the strict proper diet for their body, half of the disease is gone already. Okay, so nutrition modification is very important. This also can be done by educating them. And lifestyle modification, a new research conducted in Iran shows the lifestyle changes in diet and level of physical activity improve the health of entire communities. The lifestyle problems are smoking, drinking alcohol, using drugs, engaging in unsafe sex, or being overweight or obese. So these are all lifestyle problems we have. The biggest contribution for the most preventable diseases are the economic status, tobacco, alcohol, physical inactivity, and poor diet. So these four lifestyle behaviors need to be targeted to improve the health of the nation. So definitely lifestyle modification is very, very important. People in any stage can follow this, any age group they can follow this. So if you take any non-communicable disease, the etiology or the causes, if you go through that, all this will be there. Poor lifestyle, smoking, drinking alcohol, or being overweight, or a poor physical activity, following poor diet. So these are all the main lifestyle aspects we see in many non-communicable diseases. So definitely lifestyle modification, if we make in the people, we will see the better community later. So specific protection. This is the continuation of primary prevention. First we have seen about health promotion, and next is specific protection. What is a specific protection? Specific protection activities focuses on engaging resistance to some factors like viruses, bacteria, or modifying the environment to decrease potentially harmful interactions such as exposure to the toxic agents in the environment. I told you already, immunization, vaccines for a particular disease, we can give some particular vaccines are available. For example, for diphtheria, we have DPT, or for tuberculosis, we have BCG. So we have specific vaccines for specific disease. Use of specific nutrients. If somebody is with anemia are coming to us, we give them some iron-rich foods. We encourage them to incorporate iron-rich foods in their time. And chemoprophylaxis. If so, additional to that, some supplements also we are giving them, like iron-rich iron tablets, vitamin C tablets. So this is chemoprophylaxis. Next is protection against occupational hazards. Whomever is that is also specific protection, no? So occupational hazards, people working in industries, we give them safety shoes, we give them shields. People working in X-ray departments, we give them aprons, lead aprons. So these are all protection against specific occupational hazards, protection against accidents and carcinogens. So making them to wear helmets. So avoidance of allergens and control of hazards in the environment like air pollution and noise pollution. So these are all some of the specific protection we can do to enhance our life. Next is secondary prevention. So secondary prevention is nothing but primary prevention we have seen, no? What is that? Primary prevention is nothing but we are trying to prevent the disease before it is occurring. Okay. So whereas in the secondary prevention, the disease is already occurred. Okay. So what you can do here? The disease is already developed, but still we don't want the patient or the individual to go into the complications of the disease. Suppose if the person is diabetes, we try to control in this level, that is secondary prevention. We don't want them to meet any complications like diabetic foot ulcer or diabetic nephropathy, neuropathy. So we don't want to get into that complications. Preventing the further complications from the existing diseases, secondary prevention. Okay, how we can achieve that is by early diagnosis and treatment. Early diagnosis is very very important in any disease. Small symptoms, any small symptoms or any some of the modifications in our body, we have to note it very keenly. Anything we have to take it into account, we have to diagnosis, and early treatment is very very important. That too in cancer and all. Small lump being, if it is a small lump we notice and we get the treatment, it is entirely different, it is life saving actually. So that is what we have to do here. So early diagnosis and treatment, it helps in detecting a disease in its earliest stages before the symptoms appear and intervening to the slower stop its progression, catch it early. The assumption is that earlier intervention will be more effective than the disease can be slowed or reversed. Secondary prevention measures are delivered in the hospital, homes, or other facilities, other secondary facilities. Primary prevention can be done in the community itself because we are going to prevent the disease. It can be done anywhere, in the home, in the community, anywhere. But secondary prevention, they get some disease, so they come to the hospital. We can do only there, only in the hospitals. It compromises of diagnostic screening tools like public education to promote self-examinations to be able to recognize early signs and symptoms for the certain diseases. For example, self-breast examination for breast cancer. Okay, so that can be done. Periodically, if they do, they themselves can monitor the changes in their breast, and that can be yearly diagnosed and treated. So screening tests or specific procedures are used to detect serious diseases as early as possible so that the progress can be detained. For example, pap smear test to screen CA cervix. So this is about early diagnosis and treatment. So tertiary prevention. Next, we'll move on to the tertiary prevention. So what we have seen in the primordial prevention is controlling the risk factors itself. Okay, before occurrence. Primary prevention is preventing the disease before it is occurred, before the disease occurrence. And secondary prevention, this is already occurred, but still we are preventing the patient from the complications. What is tertiary prevention is the disease already occurred and also the disability also developed. We cannot leave them as it is, no. With the disability, you live with the disability. We cannot leave the individual like that. So in tertiary prevention, what we are trying to do is we are limiting their disability and we are making them to cope up with their life and how they can lead a normal life. That's what we are doing in the tertiary prevention. We are doing rehabilitative activities in tertiary prevention. So tertiary prevention level begins when the disease or the disability is present or is permanent and irreversible. Interventions or disability limitation and rehabilitation. What is disability limitation? Disability is defined as any restriction or lack of ability to perform an activity in the manner or with the range considered normal for the human being. So disability is nothing but any restriction. If suppose they are amputated due to diabetes, they are amputated. So they cannot lead the life which they have led before. They cannot go walk properly. They cannot go for jobs. So that is disability. The main aim is to prevent the transition of the disability into handicap. We should not make them the disability is different. Handicap is different. We should not make the small disability to be handicapped. So next is rehabilitation. So rehabilitation is it combines the uncoordinated use of medical, social, education, and vocational measures for training and retraining the individual to the highest possible level of functional ability. Okay, there are different types of rehabilitation. We have medical rehabilitation, restoration of functional ability. So whenever the stroke patients after their recovery, we make them to do some physiotherapy. We make them to go for the speech therapies. So this is restoration of the functional ability. Vocational rehabilitation is restoration of capacity to earn. Might be they cannot go to the previous job which they are working, but according to their body condition, they can go for we can make some vocational advices for them. Okay, suppose if they're handicapped, we can make them help for doing any business, any like photocopy shops or something like that. We can alter, and you or any work from home option we can opt for them. So that is vocational rehabilitation. And social rehabilitation is restoration of the family and social relationship. If you know with the HIV or any other disease, people will not get the acceptance with them. The people in the family and the society, they won't see them as before. So we have to restore that also. That is also our responsibility. Being a community health nurse, that is also our responsibility to restore the family and social relationship of the person. Because if everybody start seeing them or avoiding them, what happens? That patient feels psychologically down. Okay, so support from the family and society is very, very important to regain their confidence. So psychological rehabilitation, restoration of the personal dignity and confidence. Before they won't depend on, before any disability, what they do, they won't depend on anybody. But now for even for from small work to the big work, they have to depend on somebody else for that. So they feel little low with the low dignity and confidence. So that also we have to give them psychological support, and we have to restore all this. So that's all about the levels of prevention. So we have seen 4 levels of prevention, from primordial prevention till tertiary prevention. Primary, secondary, and tertiary. Primordial prevention is controlling the risk factors itself, that is by lifestyle changes in the children, from starting the children we are starting. And primary prevention is by health promotional activities and specific protection. Secondary prevention is by early detection, early diagnosis and treatment. Tertiary prevention is by disability limitation and rehabilitation. So concluding, implementation of the levels of prevention helps reduce disease incidence, disability, and premature death. It supports public health professionals in designing effective programs to promote well-being and improve quality of life across stages of health and diseases. So being a community health nurse, we should be aware of these levels of prevention. Why? So because we see all ages of people, all ages of the people in community we see. So everybody will be in different levels of prevention, starting from children less than 5 years, or children, they'll be in primordial prevention level. And if you go for 60 or 70 years, they'll be in tertiary level of prevention. So you have to know how you have to deal them. We have to analyze whether in which level of prevention they are, and according to them we have to give the interventions, like educating them, yearly diagnosis. Like we have so much of assessments in the community, so by that we can diagnose them earlier, and uh, we can save the community and individuals. Okay, so these are all few references from where I have taken the content. So thank you so much for listening. Hope this session would have been useful for you all. So thank you.